the two groups of people currently wearing a denture, or their teeth are so bad they have to all be removed and they don't want a denture. So if they go to your practice, or just in general, what are the options when it comes to dental implants?
Well, the first option is 2 implants on the lower. 2 implants are an option that still require or have some rocking to the denture, so I don't really like that too much. Like a
snap in, snap out.
Snap in, snap out.
You don't like that?
I don't like it because they still have movement. They still complain. They still get food underneath there, seeds underneath there.
Okay.
You can go to 3 or 4, and that's much more stable. That's much better.
For snap in?
For snap in.
Okay.
Now, the upper, I don't like snap in at all.
And that's being done? Just so I'm clear?
That's being done, but I've been around for 32 years doing these procedures, and I see after 6, 8, 10 years, I see problems with those.
Okay.
I don't want to do anything that's ever going to be a problem for a patient. I want something that I do for the patients, something that's going to last for years, hopefully till they don't last.
Okay.
So I want it to be permanent. When I say permanent, I mean permanent long time. We also give a 10-year warranty for our patients.
That's nice.
So we make sure that they're comfortable and happy and that they're insured.
So like a full arch of teeth on 4 or 6 implants, both upper and lower?
Yes.
Okay. Yeah, but for the denture on the upper, that's okay because there's suction, right? On the upper denture?
Randy, you've never worn a denture, have you?
No.
And I can tell.
Okay.
Because the denture covers up the palate. It's where the taste buds are.
Okay.
And patients hate that. Patients hate the fact they can't taste their food anymore. And there's just a lot of maintenance to those.